Can you share the story of Miss Diana, a cervical cancer patient from Zambia?
Thank you for giving me the opportunity to be involved in the care of Diana, who came from Zambia, all the way from Zambia, seeking treatment for her cervical cancer. And as the story goes, Diana had a surgery on the uterus done about a year back and presented to us with bleeding and other symptoms, which we figured out that this was related to a tumor, and the biopsy turned out to be a malignant tumor. And that's generally the protocol an oncologist would employ. To make things simple and understandable, the oncologists work in 3 steps. And that is true for any problem solving. You need a diagnosis first. As the treating doctor, I should be sure what's the disease I'm treating. And Diana came without a diagnosis. So my first job was to establish a diagnosis. And whenever there's a suspicion about a tumor, the best way to know whether it is malignant or not is to take a biopsy, which is a small bit of tissue we take from a relevant area, put it under the microscope, and the pathologist tells us what is the type of the tumor or the tissue that represents in that. So that's exactly what we did for Diana as well. We ran a whole body PET scan to stage the disease. That's how we got to know that what type of tumor Diana has and what's the stage of the tumor. Diana, do you have something to say here?